Assalamu alaikum, this is Dr. Hasna and today we'll study the wrist joint. So let's begin. The wrist joint, what type of joint is it? So wrist joint is basically a synovial joint of the ellipsoid variety. What is the wrist joint formed between? The other name for the wrist joint is the radiocarpal joint, and it is called the radiocarpal for a reason. It is very important for you to know that the ulna is not involved in the wrist joint, only the radius is being involved in the wrist joint, and the carpal bones, only the proximal row of the carpal bones, excluding the pisiform bone. These three bones are involved in the formation of the wrist joint. So if we talk about the articular surface of the wrist joint, articular surfaces of the wrist joint involves the lower end of the radius, the articular disc of the inferior radio-ulnar joint that we studied in the last video, and this is the articular surface above. The articular surface below involves the proximal row of carpal bones, only the lateral three. These are the scaphoid, lunate, and triquetral. So this is the wrist joint. Now let's talk about the various ligaments of the wrist joint. First ligament of the wrist joint is its capsule. Okay, so the articular capsule of the wrist joint. Now this is attached inferiorly to the radius and ulna's lower ends and below to the three carpal bones, the scaphoid, lunate, and triquetral. So that's the articular capsule. The articular capsule is strengthened by some more ligaments of the wrist joints. Now these ligaments are, first you have ligaments on the palmar aspect, then you have a ligament on the dorsal aspect, and finally you have the two radial collateral and the ulnar collateral ligaments. The radial collateral ligament extends from the styloid process of the radius above to the lateral aspect of the scaphoid below, while the ulnar collateral extends from the styloid process of the ulna above to the triquetral and pisiform bones below. That is simple. Now let's talk about the few ligaments in the palmar and the dorsal aspect. In the palmar aspect, we have the palmar radiocarpal ligament and the palmar ulnocarpal ligament. The palmar radiocarpal ligament basically is on the palmar aspect or in the anterior aspect of the wrist joint. It extends from the anterior margin of the lower end of the radius above and gets attached distally to the three proximal row carpal bones. And the palmar ulnocarpal starts from the anterior margin of the lower end of the ulna above and gets attached to the lunate and triquetral bones. So these are the two palmar carpal ligaments. Now let's talk about the dorsal aspect. In the dorsal aspect, there is one dorsal radiocarpal ligament. And the dorsal radiocarpal ligament basically begins from the lower end of the posterior margin of your radial bone above, and it is attached to the triquetral, lunate, scaphoid posterior parts below. So this was the dorsal radiocarpal. These are a few ligaments of the wrist joint. So the wrist joint is a radiocarpal joint. Apart from this, there is another joint which is basically the joint formed between the proximal and distal row. This is the midcarpal joint. However, we are not talking about the midcarpal. We're only talking about the wrist joint. Let's talk about the movements of the wrist joint now. The movements of the wrist joint are basically brought about by the wrist joint or the radiocarpal joint, but another joint is also involved in these movements, and that joint is the midcarpal joint. And the midcarpal joint is basically the joint formed between the proximal and the distal row bones, the midcarpal joint. However, when we talk about the wrist joint is solely the radiocarpal joint. Do not confuse it with the midcarpal joint. The midcarpal joint is basically assisting the radiocarpal joint in carrying out movements of the wrist. So what are the movements of the wrist? Let's see. There is this is the flexion. There is this is extension. There is this adduction, and there is this abduction. Apart from this, circumduction. So as I said, the first movement is of the flexion. Now this flexion is occurring more at the midcarpal joint than the radiocarpal joint. So which muscles bring about the flexion of your wrist joint? Simple. Always remember the radialis and the ulnaris muscles, they are responsible for carrying out wrist joint movements. So the flexor carpi ulnaris and the flexor carpi radialis. So both the ulnaris and radialis are carrying out the flexion movement. And also there is another muscle involved in the flexion, which is the palmaris longus, if you remember, the most prominent tendon in front of the wrist. And also some assistance is also provided to the flexion of the wrist joint by long flexors of the fingers and thumb and the abductor pollicis longus. Moving on, let's talk about the second movement, which is the extension. Now extension is also carried out by the ulnaris and radialis muscles. So the extensor carpi radialis longus, the extensor carpi radialis brevis, and then the extensor carpi ulnaris. Now let's talk about the movements of abduction and adduction. So the abduction is carried out by the radialis muscle. Why? Because abduction is basically when the wrist is moved towards the lateral side, and obviously towards the lateral side, hence there should be a lateral muscle involved. So the radialis, which is the lateral muscle, the radialis, the flexor carpi radialis and the extensor carpi radialis. Both the radialises, longus and brevis, both the radialises carry out the abduction movement. And apart from this, the abductor pollicis longus and the extensor pollicis brevis also assist in abduction. And finally is the adduction. The adduction is carried out by, obviously, since adduction is occurring towards the ulnar border, so the two ulnarises muscles, the flexor carpi ulnaris and the extensor carpi ulnaris, are carrying out adduction. And don't forget, there is fifth movement of the wrist joint as well, and this is the circumduction. The last time we studied the circumduction was in the shoulder joint. The wrist joint also has this movement. And finally, to conclude, it is important to know that the range of movement of wrist is greater in flexion and there is greater range of movement in adduction. So the abduction and extensions are a little restricted movements. The greater range of the movement is in flexion and the adduction. That's all about the wrist joint. Thank you so much for watching.